Hi guys, welcome to the whole tooth and nothing but the tooth, because sometimes the tooth hurts. And today is quite a special edition because, as you know, we've all been locked down. We've all been having all these restrictions on us. We've had restrictions going out, going to the beach, doing anything. We've been restricted. But today we're going to focus in on the dentist, because I'm your friendly favorite dentist. And we're going to be talking about the things that you can do at this time so that you can have a healthy mouth and you can prevent yourself from getting cavities. So guys, welcome back. This is your friendly dentist, your favorite dentist, Dr. Nadim Ahmed of Sunshine Dental Solutions, coming to you from sunny Florida. Yes, guys, I know you're really jealous of me that I'm sitting here in sunny Florida, but it is dark right now, so. All right, guys. So let's share those tips with you. I know a lot of you go to the dentist regularly. God bless you. The ones who don't go to the dentist regularly, God bless you too. And you know what? What we're going to talk about today is what you can do at home to prevent yourself from having dental problems. Now, the main issue here is, how can we prevent ourselves from having cavities? How can we prevent ourselves from having gum disease? These are the two things that are the basic things that happen to people. And basically, when we're talking about a cavity, it really takes three things to cause a cavity. If you have these three things, you will get a cavity. Do I need to spell that out any more than I did already? Okay, so there's got to be three things for you to get a cavity. The first thing is kind of the distant cousin of that horrible little virus that's traveling all around the world. Is called a bacteria. A bacteria is like a virus. It's something we can't see. Actually, you might be able to see it after a while when they kind of accumulate on your teeth and they form into plaque, but I'm going to be talking about that in a few minutes. So you've got to have bacteria. And here's the bad news, guys. The bad news is, guys, that there's always bacteria in your mouth. What our job is to lower the number of bacteria, to make sure there's less of them in our mouth. So how do we do that, folks? We've got to lessen the amount of bacteria. How do we do that? We do things like brushing. We do things like flossing. We do things like tongue scraping. I'll be talking to you about that a little later. If you've never heard of tongue scraping, you're in for a treat today. Okay, so let's talk about your bacteria. You're going to lower your bacteria. The second thing you're going to do to prevent yourself from getting cavities. The first thing you had to have was bacteria. The second thing that you've got to have make a cavity or get a cavity in your mouth is you've got to have some food. And I mean, come on, guys, we like to eat. I know I love my sweets, and you're saying, oh my God, that dentist likes sweets? Wait, Dad, I thought dentists didn't eat sweets. Look, I love sweets. Can I say that again? I love sweets. But here's what you've got to do. So you've got the bacteria, you've got the food. What's the third factor that causes a cavity? Now, I'm very good at controlling that third factor. The third factor is time. Time. You got bacteria, you got food, and you've got time. What do you think happens when bacteria eat the food in your mouth and then they got a little bit of time? Yeah. You're thinking, what do? What do bacteria do? Okay, I'm going to give you a little clue, folks, because this is really interesting. What happens to human beings like you and I when we eat food? We're not bacteria, mind, slithering around. We might be walking around, but we sit down, we eat food, it goes into our bodies, and about maybe for some people 6 hours later, maybe for other people it might be 12 hours later. But what do you have to do? I know you're thinking about it, but it's quite simple. The four-lettered word begins with P, and it ends in P, and it's a palindrome. Have we got it, folks? Poop! Yes, the bacteria are pooping. Yes, folks, it's really true. The bacteria eating the food, pooping on your teeth. But you know what? We don't call it poop. You know why? Because it actually looks white. It's called plaque. So these are the things that happen in your mouth. Bacteria eat the food, and about a few hours later, they form into plaque. Now, why is that so important? Because if you have plaque sitting on your teeth, plaque is very acidic. Acidic things on your teeth, because there's these layers of your teeth, and later on I'll be describing you. I'm going to make you a whole bunch of informative videos that you can understand the exact process of demineralization. I might use some big words like demineralization. I may use some little words like poop. I'm going to use all kinds of words so we can get the message loud and clear to everybody all around the world. If you're not lucky enough to be sitting in sunny Florida, you might be in sunny Spain, but you will understand exactly how to control the plaque from forming on your teeth. So here we are now. Let's summarize it. We got the bacteria. They're always there. You're going to lower the number of the bacteria. How are you going to do that? You're going to do 2 or 3 things. You're going to, 1, brush your teeth. Well, how about that, Frankenstein? Or should I say Einstein? I said the wrong guy, didn't I? Okay, Einstein. You gotta brush your teeth. Now, some people say, oh, I get patients in my office. Sometimes they come in. And I'll say, sir, how often do you brush your teeth? They're like, why'd you want to know? I said, because if you let me know and then I look in your mouth, if you've got really clean teeth, then you're one of the people that only has to brush once a day. There are some people who don't, they don't get a lot of plaque on their teeth because they don't have a lot of bacteria. They don't, their food choices are great, and they don't leave their, these things for a long time on their teeth. So they might only need to brush once a day. Now, there may be some of you who say, I brush 4, 5, 6 times a day. And you know what? I still got smelly breath. I still got cavities, and it sucks. My life sucks because every time I turn around, I keep getting cavities. Every time I go to the dentist, you tell me, oh, sir, it looks like you got a cavity in that molar on the distolinguobuccal surface. There's a cavity back there. And you're thinking, oh my God, I did my best. Okay. So let's encourage you now. Don't get discouraged, my dear friends and respected brothers, sisters, elders, youngsters, whoever you are out there. We are going to help you. So here's what you've got to do. If you're one of the people that goes to the dentist and they give you a pat on your back, good job, go, keep doing what you're doing. If you're one of the people that goes to the dentist and every time you go, you're like, oh man, every time I go, I get a cavity. Okay, so what you're going to do is control one of those 3 things. Bacteria, you're going to control them by doing what? Brushing, flossing. You're going to increase the frequency. A lot of times people are asking me, I don't like flossing. Listen, nobody likes flossing at first. When you get used to flossing, you will not be able to go without flossing. Flossing, what does it do? It takes the bacteria out between your teeth. Teeth, they're right next to each other. So you're brushing this side, you're brushing that side, you're brushing this side, you're brushing the underside, the overside, but you can't get between your teeth. So the floss, what it does is it goes between your teeth and it takes the bacteria out from between your teeth. Second thing we talked about, food, choices of food. Now, I did admit it earlier, on public television, or what do we call this? Whatever we call this, that I like sweets. So what do I need to do? If I'm a person that likes to eat sweets and indulge in all those things that are bad for your teeth, what I've got to do is I've got to clean them more frequently. So what you're going to do is you're going to brush more frequently and floss more frequently. And truth be told, if you talk to my kids or my family, they're going to tell you, I've always got a toothbrush in my mouth. Wait a minute. I've always got a floss pick in my pocket. Why? Because you never know when you need to get those little critters out from between your teeth. So I've always got one in my pocket. And it's clean right now. See? There's no bacteria on it. So when it gets bacteria on it, you're going to throw it away. So we talked about brushing, flossing, and the third factor in controlling those little bugs in your mouth is going to be tongue scraping. And now that does sound a bit nasty, tongue scraping, but what we're going to do there is we're going to clean off the bacteria off our tongues. And you know what? If you imagine what the tongue is like, it's a beautiful organ, helps us speak, helps us to lick our lips. Like earlier on today, I was enjoying my lovely chocolate ice cream, I'm licking it. So it helps us do so many things, little things, but they're so enjoyable. So here's what we need to do. Our tongue, we need to take good care of it. Just like everything else in our body, we love to do things to take care of ourselves. So the tongue is one of them. What you're going to do is you're going to get your toothbrush. After you've gone to the top teeth, this side, the lower side, the left side, the outside, you're going to go to the tongue side. And on the tongue side, what you're going to do is you're going to gently brush your tongue. And you know what that's going to do? That's going to lower the bacterial counts on your tongue. You know, another thing it does is, and you know, this is a beneficial side effect. After you've reduced the number of bacteria, it's going to give you better breath. Okay, so we've covered the bacteria. The bacteria have been controlled with brushing, flossing, tongue scraping. And you know what? I got to tell you what, I got to admit, I wouldn't be telling you the truth unless I told you this. I like to use mouthwash. Now, here's the thing. You've lowered the bacterial count. Do the bacteria have a chance? The bacteria don't have a chance in this mouth, do they, folks? They haven't got a chance, have they? So don't give them a chance in your mouth. You do the brushing, the flossing, the tongue scraping, and then when they think they've hidden in some corner of your mouth, in the grooves of your teeth, you knock them out with that mouthwash. Okay. Got it? Okay, folks. All right, soldiers. We're going to go on to the next point, the food. How do we control the food? We're going to eat less sugared foods. We're going to eat more healthy snacks. And you're going, yeah, whatever. And I'm saying to you, yeah, if you're like me, you're going to indulge in chocolate. You're going to have all the things you shouldn't be eating. But then what you're going to do is you're going to brush and floss and tongue scrape and use mouthwash. And then the last thing, time. Now, why is time really important? It's because that's when it comes to the amount of times you're brushing per day. If you're just brushing once a week, listen, okay, people come in to the office and they'll say, I'll say, excuse me, sir, and I'm going to blame the men because it's usually the men. Excuse me, sir, how often do you brush your teeth? And they'll say, sometimes. I'm like, is sometimes during the day? Sometimes during the night, sometimes during the month, sometimes during the year. Can you give me a little more clue as to what that means to you? Okay, they'll say, yeah, sometimes I brush my teeth when I get something stuck in my teeth. So right away I know, okay, this person is not brushing, flossing. And you know what the next thing is going to be? And I hate going to the dentist. I only go when I'm in pain. Do you see what I'm saying? This is one of those factors that you didn't take care of the three factors. You didn't take care of bacteria. You didn't take care of the food. You only do stuff in your mouth. Don't do that to yourself, folks. Don't hurt yourself. Help yourself, folks. So here's what we want to do. We want to limit the time. So we're going to limit the time by brushing and flossing more frequently. So folks, this is the key. Right now you're in lockdown. You may not be in lockdown, but you haven't been able to see your dentist. By the way, dentist, we made an oath to help the people. So go help the people, go help your patients, because I know I've been open this whole time during this virus and people have been coming from all over the place. Emergency this, emergency that, swelling this, swelling that. And they say that they cannot get hold of the dentist. So I have a humble request to all his healthcare providers. Go be your heroes. Go be your patients' heroes and go help them out when they really need you. And you know, it's really important that we protect ourselves, so do all the preventative measures so that we can go help the people. All right, folks, so I'm here for you. I'm here for all the folks. I'm here for dentists, for hygienists. I'm here to help you through this situation that you have. I know the dentist is stressed out, the patients are stressed out, so look out for more videos highlighting details about how you can take care of yourself. And I'm going to give you all the insights, folks. I'm going to give you all the details. If you're on the fence about fixing your teeth, whether you're thinking, oh, shall I just get rid of them all? God forbid. But sometimes people think, oh, just get rid of all my teeth and I'm going to not have to deal with my teeth anymore. But I'm going to talk to you about the pros and cons. So tune in again. This is your favorite dentist, Dr. Nadim Ahmed of Sunshine Dental Solutions. And remember, folks, I like mine waxed.